Over the age of 50, your urine can reveal kidney damage months, even years, before any symptoms appear. But most people miss the warning signs, and by the time they're diagnosed, up to 90% of kidney function can already be lost. Today, I'll walk you through 8 early signs of kidney failure that show up in your urine and exactly what to do if you spot them. If you're over 50, this is one of the most important health checklists you'll ever hear. Kidney disease often develops silently. By the time obvious symptoms like swelling or fatigue appear, the damage can be advanced. But here's the good news. Your urine gives early, clear signals, and with modern testing, kidney disease can be detected early and managed effectively. In this video, we'll cover 8 key urine changes, the science behind why they happen, what to ask your doctor, and how to protect your kidneys long-term. Sign number 1: persistent foamy or frothy urine. One of the earliest and most overlooked signs of kidney problems is noticing persistent foam or froth in the toilet after urinating. Occasional bubbles can happen to anyone, especially if you have a strong urine stream or haven't flushed right away. However, if the foam is thick, soap-like, and doesn't clear within a few minutes, this may indicate protein in the urine, medically called albuminuria or proteinuria. Healthy kidneys act like fine filters, allowing waste and water to pass into the urine while keeping essential proteins, such as albumin, inside the blood. When these filters, called glomeruli, become damaged due to conditions like high blood pressure, diabetes, or age-related decline, they start to leak protein. This leaked protein interacts with the air and forms persistent foam. This sign can appear long before standard kidney blood tests, like eGFR, show abnormalities, making it one of the earliest warning signals of chronic kidney disease, CKD. If you observe this consistently, ask your doctor for a uACR test, urine albumin to creatinine ratio. According to the National Kidney Foundation and the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, a result of 30 milligrams per gram or higher on 2 tests at least 3 months apart strongly suggests kidney damage. Of course, foam doesn't always mean disease. Temporary froth can be caused by dehydration, vigorous urination, residual cleaning agents, or occasionally after a high-protein meal. But if the foam is persistent, especially in people over 50 or those with diabetes or hypertension, it's best to get tested early. Catching albuminuria early allows for timely treatment, potentially slowing or preventing kidney failure. Sign number 2: pink, red, cola, or tea-colored urine. Seeing your urine turn pink, red, or brownish cola-colored can be alarming, and rightly so. This change often indicates the presence of blood in the urine, a condition known as hematuria. While it doesn't always mean something serious, any visible blood in urine should be medically evaluated. The shade of the discoloration offers important clues. When the urine appears cola or tea-colored, it often points to bleeding originating in the kidneys. This typically occurs when the tiny filtering structures called glomeruli are inflamed or damaged, allowing red blood cells to leak into the urine. Conditions like glomerulonephritis, certain infections, or autoimmune diseases can cause this. In contrast, bright red urine usually suggests bleeding from the lower urinary tract, such as the bladder, ureters, or urethra. Common causes include kidney or bladder stones, infections, or, more rarely, tumors. Even if the discoloration occurs just once and disappears, it's important not to ignore it. Your doctor will likely start with a dipstick urine test to detect blood, followed by microscopic examination to confirm whether red blood cells are truly present. If hematuria is confirmed, further investigations may include imaging, like ultrasound or CT scan or cystoscopy to visually examine the bladder and urinary tract. There are also benign explanations to rule out. Certain foods such as beets, blackberries, or rhubarb, some medications, menstrual blood, or strenuous exercise can temporarily cause red or brown urine. However, it's impossible to distinguish harmless from harmful causes by appearance alone, so medical testing is essential. Early evaluation of hematuria can help detect kidney disease, stones, or urinary cancers in their earliest, most treatable stages, making this one sign you should never overlook. Sign number 3. Cloudy urine or stringy particles. Urine that looks cloudy, milky, or contains stringy, thread-like particles can be an important early clue that something isn't quite right. In many cases, this appearance is linked to the presence of white blood cells or bacteria, a condition known as pyuria. This often signals a urinary tract infection, a common but potentially serious issue, especially for people over 50. When bacteria enter the urinary tract, the immune system responds by sending white blood cells to fight the infection. These cells, along with the bacteria and their byproducts, can make urine look cloudy or even slightly thick. In some cases, there may also be a strong or foul odor, or symptoms like burning during urination, increased frequency, or mild lower abdominal discomfort. However, not all infections cause obvious symptoms. This is especially true in older adults, where infections may remain silent longer. If a UTI is left untreated, it can spread upwards to the kidneys, causing pyelonephritis, a more serious infection that can lead to kidney damage or scarring over time. This is why cloudy urine should never be dismissed if it persists. Request a dipstick urine test to check for leukocyte esterase, an enzyme released by white blood cells, and nitrites produced by certain bacteria. If positive, your doctor will likely order microscopic analysis and a urine culture to identify the bacteria and guide proper treatment. There are non-infectious causes as well. Dehydration can lead to crystal formation that clouds urine, and semen or vaginal discharge can mix with urine and give it a stringy appearance. However, persistent cloudiness, especially alongside symptoms, should always prompt medical evaluation to protect your kidneys from long-term harm. Sign number 4. Frequent night urination. Nocturia. Waking up multiple times at night to urinate, known as nocturia, is often dismissed as a normal part of aging. But in many cases, especially in people over 50, it can be an early sign of kidney problems, specifically chronic kidney disease. Healthy kidneys have an important nighttime job. They concentrate urine while you sleep. This allows your bladder to hold more urine without triggering the urge to wake up. However, when the kidneys start to lose their ability to concentrate urine properly, they produce larger volumes of dilute urine during the night, leading to frequent bathroom trips. This phenomenon is called nocturnal polyuria, and it often appears early in CKD, even before significant changes show up in blood tests. Nocturia is not only a potential marker of declining kidney function, it also affects sleep quality, energy levels, and overall well-being, especially in older adults. Repeated disruptions can increase fatigue, impact cardiovascular health, and lower quality of life. If you notice you're waking up more than twice per night to urinate on a regular basis, it's worth getting tested. Ask your doctor for eGFR estimated glomerular filtration rate to check kidney function, uACR urine albumin to creatinine ratio to detect early kidney damage, electrolytes and blood pressure check, as high blood pressure and kidney function are closely linked. Not all nocturia is kidney-related. Drinking too much fluid in the evening, consuming caffeine or alcohol, Sleep apnea or prostate enlargement in men can also increase nighttime urination. However, persistent nocturia, especially alongside other urine changes, should prompt a closer look at kidney health. Sign number 5. Passing unusually large amounts of very light urine, polyuria. Another subtle but significant early sign of kidney trouble is polyuria passing abnormally large amounts of very pale or almost water-like urine, often throughout the day and sometimes at night. While drinking more fluids can naturally increase urine output, persistent, excessive urination without a clear cause may indicate that your kidneys are struggling to concentrate urine properly. Normally, the kidneys finally adjust how much water is excreted, creating urine that is more concentrated when fluid intake is low. This is done through specialized structures called renal tubules, which reabsorb water back into the bloodstream. However, in certain types of chronic kidney disease, particularly tubulo-interstitial diseases, these tubules become damaged. As a result, they lose their ability to concentrate urine efficiently, leading to large volumes of dilute urine, even if you're not drinking excessively. Over time, this loss of concentrating ability can contribute to dehydration, electrolyte imbalances, and worsening kidney function if not monitored. If you experience ongoing excessive urination, ask your doctor for a 24-hour urine volume test to accurately measure total daily output, serum, sodium, and glucose levels, since abnormalities in these can influence urine production. A medication review, particularly if you use lithium or diuretics, which can affect kidney concentrating ability. In select cases, a water deprivation test may be done under medical supervision to assess how well the kidneys can conserve water. High fluid intake, uncontrolled diabetes mellitus, or diabetes insipidus, a hormonal imbalance, can also cause polyuria. But when none of these are present and polyuria persists, it may point to early kidney damage, and testing becomes essential. Sign number 6. Dark amber urine that stays dark despite good hydration. The color of your urine can reveal a lot about what's happening inside your body. In most cases, dark amber or deep yellow urine simply indicates dehydration. When you're not drinking enough fluids, your kidneys conserve water, resulting in more concentrated urine with a darker color. Typically, once you hydrate adequately, your urine should lighten to a pale straw yellow. However, if your urine remains dark, amber, brownish, or tea-colored despite proper hydration, this can signal something more serious, and it's important not to ignore it. Persistent dark urine may indicate the presence of blood, bilirubin, a liver byproduct, or muscle breakdown products such as myoglobin, any of which require medical testing to identify the cause. In the context of kidney health, blood in the urine, hematuria, can make urine appear brownish or cola-colored, often reflecting bleeding from within the kidneys. Alternatively, bilirubin in the urine, which is not normally present, may indicate liver or bile duct issues, such as hepatitis or obstruction. Rarely, myoglobinuria, resulting from muscle injury or breakdown, can also darken urine. If your urine remains dark for more than a day or two after increasing fluid intake, ask your doctor for a urinalysis to check for blood and protein. If bilirubin is suspected, a liver function panel can help identify underlying liver or bile duct problems. Other factors to consider. Certain foods, like fava beans, or medications, such as some antibiotics or antimalarials, can temporarily darken urine. But persistent darkness without dietary or medication causes should always be investigated, especially for those over 50, since both kidney and liver disorders become more common with age. Sign number 7. Positive dipstick for protein, or blood, even if urine looks normal. Sometimes, your urine can look completely normal, but a simple dipstick test tells a very different story. This is one of the most important early warning signs of kidney disease because microscopic changes often appear long before any visible symptoms or color changes do. A dipstick urinalysis can detect tiny amounts of protein, usually albumin or microscopic blood, that aren't visible to the naked eye. In healthy kidneys, protein is retained in the bloodstream, and urine should contain no blood. When kidney filters become damaged, albumin starts leaking into the urine even in small amounts, which may indicate early chronic kidney disease, CKD. Similarly, microscopic hematuria blood cells in urine, not visible without a microscope, can signal kidney inflammation, stones, or other urinary tract issues. This is why routine urine screening is strongly recommended for at-risk adults, particularly those over 50, or with diabetes, high blood pressure, or a family history of kidney disease. These groups have a higher likelihood of early, silent kidney changes that can be caught only through testing. If a dipstick test shows protein or blood, your doctor should follow up with uACR urine, albumin to creatinine ratio, to quantify protein leakage, eGFR, estimated glomerular filtration rate, to assess kidney function. Both tests should be repeated after at least 3 months to confirm persistence, as recommended by KDIGO Kidney Disease Improving Global Outcomes Guidelines. The results are then classified using a GFR plus albuminuria grid, which helps determine your CKD stage and follow-up plan. This simple screening can detect CKD years earlier than symptoms appear, allowing for lifestyle changes and treatment to slow or even prevent kidney failure. Sign number 8, urine that smells off, plus burning, fever, or back pain. Your urine's smell can sometimes provide early clues about your health. While mild variations in odor are normal, often influenced by hydration, certain foods, like asparagus, vitamins, or medications, a strong, foul, or unusual smell, especially when paired with burning during urination, fever, or back pain, should not be ignored. This combination frequently points to a urinary tract infection, UTI, which can have serious consequences if untreated, especially in older adults. UTIs occur when bacteria enter and multiply in the urinary tract. In the early stages, the infection typically affects the bladder, cystitis, causing symptoms like foul-smelling urine, urgency, and burning. If not treated promptly, the infection can ascend to the kidneys, leading to pyelonephritis, a deeper infection that can cause fever, chills, flank, back pain, and general malaise. Recurrent or untreated infections can damage kidney tissue over time, creating scarring that gradually impairs kidney function. Older adults are particularly vulnerable because UTIs can present atypically, sometimes with minimal urinary symptoms. Subtle changes in urine smell or new nighttime urination patterns may be the only early signs before the infection worsens. If you notice persistent changes in urine smell accompanied by any discomfort or systemic symptoms, ask your doctor for a urinalysis to check for leukocyte esterase, white blood cells, and nitrites produced by bacteria, a urine culture to identify the exact bacteria and guide appropriate antibiotic treatment. When to seek urgent care. If you develop fever, chills, or flank pain, seek medical attention immediately. These are signs the infection may have reached your kidneys. Prompt diagnosis and treatment not only relieve symptoms, but protect your kidneys from long-term damage. Action plan and safety. If you notice any changes in your urine, whether it's foamy, discolored, cloudy, unusually frequent, or has a strong odor, the first step is to observe carefully. Keep your hydration consistent and track the changes for 24 to 48 hours. Many short-term variations can result from diet, fluid intake, or temporary factors. However, if the changes persist or are accompanied by pain, fever, swelling, or fatigue, it's time to seek medical attention. Don't ignore these signs, especially if you're over 50 or have risk factors like diabetes or high blood pressure. Ask your doctor for 3 essential tests: uACR to detect early protein leakage, eGFR to assess kidney function, urinalysis to check for blood, infection, or other abnormalities. If any results are abnormal, they should be repeated after at least 3 months to confirm chronic kidney disease, following international KDIGO guidelines. Meanwhile, focus on kidney protective habits, manage blood pressure and blood sugar, quit smoking, and review medications with your clinician to avoid kidney-harming drugs. Early action can make the difference between manageable disease and preventable kidney failure. Who's at highest risk after 50? Once you cross age 50, your kidneys naturally experience some age-related decline, but certain conditions and lifestyle factors can significantly increase the risk of developing chronic kidney disease. If any of the following apply to you, it's especially important to monitor your urine and get regular kidney tests. Diabetes, the leading cause of CKD due to long-term high blood sugar damaging kidney filters. High blood pressure, hypertension, puts constant stress on kidney blood vessels. Cardiovascular disease, reduced circulation affects kidney health. Family history of kidney disease increases your baseline risk. Recurrent urinary tract infections or kidney stones can scar kidney tissue over time. Long-term use of NSAIDs, like ibuprofen, may reduce blood flow to the kidneys and cause injury. Medications such as lithium or other nephrotoxic drugs can damage kidney tubules with prolonged use. If you fall into any of these categories, regular screening with uACR and eGFR becomes essential. Early detection allows for lifestyle changes and treatment that can protect your kidney function well into older age. Your urine is more than waste, it's an early warning system. By paying attention to these 8 signs and requesting simple tests like uACR, urinalysis, and eGFR, you can catch kidney problems early when they're most treatable. If you're over 50, especially with risk factors like diabetes or high blood pressure, talk to your doctor about adding these urine tests to your routine annual checkup. And remember, changes don't always mean kidney failure, but they always deserve to be checked. Don't wait for symptoms to become severe. If you found this video helpful, hit like, subscribe, and watch our next video on 5 silent signs of liver trouble you should never ignore.